So my name's Jayashri Kulkarni and I'm Professor of Psychiatry at the Alfred, and I'm also the Director of the Monash Alfred Psychiatry Research Centre. I'm delighted to speak about the Women's Mental Health Clinic. So the clinic is held here, and we also have a number of other rooms in which we have consultations. It is a second opinion clinic, and that's important because what it means is that we can offer management suggestions for women who have really plateaued in their treatment for all kinds of disorders. So we see women who have schizophrenia, who have depression, who have anxiety disorders and many other disorders. But in particular, there is a hormone element running through their illness. So they might have noticed that they get worse around menopause or at certain times of the month and so on. And I'm delighted that in this clinic I work with an endocrinologist, Dr. Rosie Worsley, who's been working here since she was a senior registrar and is now an endocrinologist. And that's an unusual combination to have two disciplines, psychiatry and endocrinology, in the same clinic. But I think it means that we can offer our patients a whole lot of extra things that don't happen in normal clinical practice. We're also delighted that the clinic is a translational arm for research. So a number of our clinical trials, including work with the brain estrogens and some of the other trials that we're running, are open for our clients to actually participate in. And so there's a double strategy that women come to our clinic seeking the latest of the latest and also a second opinion. We also have a teaching element to our clinic, and on a number of occasions we have MBBS or doctors in training coming and sitting in on the consultations. We also have psychologists and a number of other disciplines people come in to sit in and see what we're doing. We've had some tremendous feedback from our patient population, and we actually were nominated for a Victorian Healthcare Award last year, and we were given a highly commended by the Minister of Health. So we're really thrilled with the work that goes on here, and particularly the quality of life, when we can improve that for some women who are really experiencing hardship and their families. That's what keeps us going, really.
So my name's Dr. Rosie Worsley and I'm an endocrinologist, so that means I'm a medical specialist that specialises in hormones, and my particular area of interest is women's hormones. So my role at the clinic really is to look at the physical health aspect of women who might be suffering with some mental health problems, and particularly the way that their hormones fit into it and the way that their hormones might be impacting on their mental health. And part of that is looking at what sort of hormonal therapies we might be able to use to help them, particularly with their mental health and to improve their quality of life overall. It's a very unique clinic in that it's myself and Professor Kulkarni working together, and it's not just unique in that it's two specialties working together, but it's also that we do double consult. So we will usually see the same person together. So there's real collaboration, and it means that we're both on the same page and the person gets maximum bang for their buck. There's very few clinics in the world that really do look at the hormonal aspect of women's mental health. There's a few places overseas, but I'm not aware of any clinics, any publicly funded clinics where women are able to go and get that level of input. So MAPrc is fantastic for research. It's an extremely supportive environment. So I myself am doing a PhD partly based here. And there's a lot of very good mentoring and fantastic teaching in terms of research skills. I think what's also great is that there are so many different disciplines involved. So you get a lot of discussion between disciplines, which is fantastic. And there's a lot of different projects that students can choose from.
My name's Guyan Damel and I'm the clinic coordinator for the Women's Mental Health Clinic. I deal with the administration of the clinic, so it's because it's quite a unique clinic. We're very busy and we've got a lot of patients. It runs once a week on a Thursday and we've got quite a waiting list at the moment. We keep in touch, keeping communication open with the patients, making sure that they know that they're going to be looked after and that we acknowledge them and that we're going to see them. We're Medicare billed, well Medicare funded, so Medicare billed, so there's no out-of-pocket expenses for our patients. I think that's another reason why we are quite oversubscribed. Ahead of a consultation, sometimes if a patient's suitable, we'll put them into one of our research trials or get in touch with one of our research staff to see if they can be put onto a trial.